1. Which of the following is the primary focus of community health nursing? A. Providing direct care to individuals. B. Managing acute illnesses in hospitals. C. Promoting health and preventing diseases in populations. D. Conducting research in healthcare settings. Rationale: community health nursing focuses on promoting health and preventing diseases at the population level through various interventions such as health education, screenings, and community outreach programs. 2. What is the primary goal of community health assessments? A. Identifying individuals with chronic diseases. B. Evaluating the effectiveness of healthcare facilities. C. Assessing the health needs and assets of a community. D. Diagnosing acute illnesses in the community. Rationale: community health assessments aim to gather data on the health status, resources, and needs of a community to develop targeted interventions and programs. 3. Which of the following is an example of primary prevention in community health nursing? A. Administering vaccines to children. B. Providing wound care to a patient with diabetes. C. Teaching relaxation techniques to reduce stress. D. Screening for hypertension in adults. Rationale: primary prevention focuses on preventing the onset of disease or injury before it occurs, such as through immunizations to protect against infectious diseases. 4. A community health nurse is conducting a home visit to a family with young children. Which assessment finding should be addressed first? A. The family's lack of access to healthcare services. B. The child's elevated temperature and cough. C. The home environment being cluttered and unsafe. D. The parent's limited knowledge of nutrition and child development. Rationale: assessing and addressing acute health problems such as fever and cough in children are immediate priorities to prevent further complications. 5. Which of the following interventions is an example of secondary prevention in community health nursing? A. Providing smoking cessation counseling to adults. B. Conducting screenings for breast cancer in women. C. Educating pregnant women about prenatal care. D. Promoting physical activity among school-aged children. Rationale: secondary prevention aims to detect and treat diseases in their early stages to prevent progression, such as through cancer screenings. 6. Which of the following is a key component of the community health nursing process? A. Diagnosing individual health problems. B. Providing bedside care in hospitals. C. Conducting community assessments. D. Administering medications to individuals. Rationale: community health nursing involves assessing the health needs and resources of communities to plan and implement effective interventions. 7. Which of the following is an example of a community-level intervention? A. Providing wound care to a patient at a clinic. B. Counseling a family on healthy eating habits. C. Implementing a smoking cessation program in schools. D. Administering insulin to a diabetic patient. Rationale: community-level interventions target populations or communities as a whole to promote health and prevent diseases. 8. A community health nurse is developing a program to address the high prevalence of obesity in a community. Which of the following strategies would be most effective for primary prevention? A. Providing bariatric surgery options to individuals. B. Offering nutrition counseling and cooking classes. C. Screening individuals for obesity-related health conditions. D. Prescribing weight loss medications to individuals. Rationale: primary prevention aims to prevent the onset of obesity through lifestyle modifications and health education. 9. Which of the following is an example of a social determinant of health? A. Access to healthcare services. B. Genetic predisposition to certain diseases. C. Socioeconomic status. D. Lifestyle choices. Rationale: social determinants of health, such as income, education, and employment, significantly impact health outcomes and access to healthcare. 10. A community health nurse is collaborating with local organizations to improve access to healthy foods in a low-income neighborhood. This intervention is an example of A. Secondary prevention. B. Tertiary prevention. C. Health promotion. D. Disease management. Rationale: health promotion interventions aim to empower individuals and communities to achieve optimal health and well-being. 11. Which of the following best describes the role of a community health nurse in disaster preparedness? A. Providing direct care to disaster victims in emergency shelters. B. Conducting community assessments to identify disaster risks. C. Administering vaccinations to prevent the spread of diseases during disasters. D. Collaborating with local agencies to develop disaster response plans. Rationale: community health nurses play a key role in disaster preparedness by collaborating with stakeholders to develop and implement plans for responding to emergencies. 12. Which of the following strategies is most effective in reducing health disparities in underserved communities? A. Implementing targeted health education programs. B. Providing free healthcare services to low-income individuals. C. Advocating for policy changes to address social determinants of health. D. Conducting screenings for chronic diseases in community settings. Rationale: addressing social determinants of health, such as poverty and education, is essential for reducing health disparities in underserved communities. 13. A community health nurse is conducting a needs assessment in a rural community. Which of the following factors should be considered when identifying priority health needs? A. Availability of healthcare providers. B. Proximity to hospitals and clinics. C. Cultural beliefs and practices. D. Access to health insurance. Rationale: cultural factors influence health beliefs, behaviors, and healthcare seeking patterns, which must be considered when identifying health needs in diverse communities. 14. Which of the following interventions is an example of tertiary prevention in community health nursing? A. Providing prenatal education to expectant mothers. B. Screening individuals for early signs of hypertension. C. Rehabilitating individuals with chronic diseases. D. Implementing smoking cessation programs in schools. Rationale: tertiary prevention focuses on managing and minimizing the impact of chronic diseases through rehabilitation and supportive services. 15. A community health nurse is planning a health promotion campaign to encourage physical activity in a sedentary population. Which of the following strategies would be most effective for behavior change? A. Distributing informational brochures about the benefits of exercise. B. Offering incentives, such as gym memberships, for participation. C. Organizing group exercise classes in community centers. D. Partnering with local schools to incorporate physical education into the curriculum. Rationale: group exercise classes provide social support and motivation, making them effective for promoting behavior change in sedentary populations. 16. Which of the following is an example of a community-level intervention aimed at promoting mental health? A. Providing individual counseling to clients with depression. B. Implementing a community-wide mental health awareness campaign. C. Prescribing antidepressant medications to individuals. D. Conducting psychiatric evaluations in a clinic setting. Rationale: community-level interventions target populations or communities as a whole to promote mental health and prevent mental illness. 17. A community health nurse is conducting a health education session on safe sex practices. Which of the following principles should guide the nurse's approach? A. Using fear-based tactics to emphasize the consequences of unsafe sex. B. Providing accurate information in a non-judgmental and culturally sensitive manner. C. Focusing exclusively on abstinence as the only acceptable form of contraception. D. Assuming that all individuals have the same knowledge and beliefs about sex. Rationale: effective health education involves providing accurate information in a respectful manner that respects individual beliefs and values. 19. Which of the following strategies is most effective for promoting vaccination uptake in a community? A. Providing incentives, such as gift cards, for getting vaccinated. B. Mandating vaccination for all individuals regardless of personal beliefs. C. Conducting community outreach and education about the benefits of vaccination. D. Punishing individuals who refuse to get vaccinated by restricting access to public spaces. Rationale: community outreach and education are effective strategies for addressing vaccine hesitancy and increasing vaccination uptake in communities. 20. A community health nurse is developing a disaster response plan for a local nursing home. Which of the following considerations should be prioritized? A. Identifying emergency evacuation routes and procedures. B. Stockpiling medical supplies and medications. C. Conducting drills to practice emergency response protocols. D. Establishing communication channels with local emergency agencies. Rationale: ensuring the safety of residents during emergencies requires careful planning and coordination, including the identification of evacuation routes and procedures. 21. Which of the following is an example of a community-level intervention aimed at preventing childhood obesity? A. Providing individual nutrition counseling to overweight children. B. Implementing a school-based physical activity program for all students. C. Prescribing weight loss medications to children with obesity. D. Offering cooking classes for parents of overweight children. Rationale: implementing school-based physical activity programs targets the entire student population and promotes healthy behaviors to prevent childhood obesity. 22. A community health nurse is conducting a needs assessment in a rural community. Which of the following factors should be considered when identifying priority health needs? A. Proximity to healthcare facilities. B. Availability of health insurance coverage. C. Access to public transportation. D. Demographic characteristics and health indicators. Rationale: demographic characteristics and health indicators provide valuable information for identifying priority health needs and developing targeted interventions. 23. Which of the following is an example of a structural intervention to address health disparities in underserved communities? A. Providing free healthcare services at a community clinic. B. Offering transportation vouchers for healthcare appointments. C. Implementing policies to increase access to affordable housing. D. Conducting health screenings at a local health fair. Rationale: structural interventions focus on addressing underlying social determinants of health, such as housing, employment, and education, to reduce health disparities. 24. A community health nurse is planning a health promotion campaign to reduce the incidence of tobacco use in adolescents. Which of the following strategies would be most effective for behavior change? A. Distributing educational materials about the risks of smoking. B. Imposing fines for underage tobacco possession. C. Implementing tobacco-free policies in schools and community centers. D. Offering nicotine replacement therapy to adolescent smokers. Rationale: implementing tobacco-free policies creates supportive environments that discourage tobacco use among adolescents. 25. A community health nurse is participating in a disaster response team following a natural disaster. Which of the following actions should the nurse prioritize during the initial response phase? A. Providing psychological first aid to survivors. B. Distributing food and water to affected populations. C. Conducting health screenings for disaster-related injuries. D. Establishing communication channels with emergency responders. Rationale: providing basic needs such as food and water is a priority during the initial response phase of a disaster to ensure the safety and well-being of affected populations.